Okay, on a serious note here, we just wanted to pop on this podcast here, Vets Talk Pets, just do a quick little update on what's going on with COVID, coronavirus, and I want to say that whatever I say today probably isn't going to be right tomorrow.
True.
And what I say today is probably not what I would have said yesterday. And I don't mean that facetiously. This is a rapidly changing. I kind of want to say that nobody really knows what's going on. We have a lot of experts and pundits on the radios and TVs saying this and saying that. But the real experts that you listen to, they'll tell you exactly what I just told you. Not that I'm an expert, but I mean, they'll just admit that this is an evolving disease process, an evolving epidemic, and now pandemic. And the fact that it went from an epidemic to a pandemic is an evolution in itself. It's an evolving situation. Anything I'm telling you is not just I'm coming on here and you've heard all these lies and things, so here's the truth. That's really not the case. It's just I want to talk a little bit and kind of air it out a little bit so you all know how we feel right now and go from there. What do you think? Julie's on here with me.
Yeah, so it's been a real interesting time, especially at the office. And
Wow.
You guys are doing a great job trying to stay open and trying to be there for all the pets.
Trying to stay open, Julie, is amazing. It's such a plethora of emotions on, yes, we're essential business and we want to stay open for the pet's health. That's why we're here for pet's health, right? Okay. That's what we do every single day. But there's a lot more going on staying open right now because my staff, well, they need an income.
Right.
So, I mean, there's the stress on, quite honestly, me to provide a living for the staff that I love so dearly. I love them so dearly. I just want to keep them working. But on the other side of that coin is I want them to stay working in a safe environment.
Right.
And I can't necessarily control everything about this virus. I can control a lot of things. We can wash the heck out of our hands. We can wear masks when it's necessary. We can clean the clinic. It's never been cleaner. It's just never been cleaner.
True.
We can wipe doorknobs. We can have people at curbside not come into the building. We're doing more telemedicine now, so people don't even have to come in at all, but we can still help your pets. So, I mean, I want the pets to be healthy. I want my staff to be healthy. I want my staff to make a living. And I want my clients to feel safe and healthy coming into the clinic too. So it's just a time. I've been in practice 40 years now, and I've never seen a time like this. And I want to make it perfectly clear. I'm as peaceful and happy in navigating through this crisis than I have ever been. It's a challenge that I take head on with all the concerns that I just told you about. But I look at it as a challenge that we're going to come out the other end better than we ever were before. We're going to come out different.
Right. And we're going to have learned a lot of things.
We're going to be so much different, but I think it's going to be better.
So I think the main question, and I think the news media has done a really good job, but people that know you and have pets that they take to you might want to hear it from you. Can humans get coronavirus from pets?
No. The answer is no. No other discussion. No other discussion about that. The answer is no, 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 no. Now, we all know that some cats have got it and some dogs have got it and some tigers have got it. Those are anomalies. And quite honestly, that is us giving it to them.
Right.
The animals should be mad at us.
Right.
We shouldn't be mad at the animals.
Right. So if someone does have coronavirus, what should they do with their pet?
Okay, the AVMA, the American Veterinary Medical Association, AVMA, gives me an update, and all veterinarians across the country. It's the source that I look at every day.
Right.
Just like the governor's on the radio every day, the president's on TV all the time. The AVMA, guys, is on this, and I'm getting updates every single day. And they are recommending that if you have COVID, you've got it, you've been diagnosed with it, and you're probably quarantined at home with it. Most people are just getting quarantined at home unless you're ill with it and have to be hospitalized. But if you're at home diagnosed with COVID, you should probably isolate yourself from your dog too. Not that the dog's going to get it and give it to somebody else in your house or anything. Dogs, here's the way I try to look at it and make it simple. Dogs are just like a doorknob or a handrail. If you've got COVID and you touch a handrail and somebody else touches that handrail, they can get COVID if they put that up in their face and we rub our eyes and things. That's why we're saying wipe down surfaces, wipe down doorknobs, and wash your hands so much. Well, if you've got COVID and you're petting your dog, it's going to be on your dog. So you should probably not have that dog around other members of your household because it could be passed that way. The dog doesn't have COVID and going to give you COVID by coughing on you. It's just got COVID on its surface, just like a doorknob has COVID on its surface. Does that make sense?
Yes. And so the one that was in Hong Kong, that was a very weak positive. And I think the owner had it, right? And the dog was
17.
It was 17 years old, and they quarantined it for 14 days of its life, and then it died because it was old.
And it tested negative for COVID 5 times after it tested positive 1 time. So, I mean, the point is, out of billions of cases of, possibilities of dogs being around people, this one dog that had all these special circumstances, there is no way you can call that a crisis of any kind. So that's why I started out the conversation. The answer is no.
Right.
Pets can't give you COVID. They don't have COVID in their system, and they're not sick with COVID and giving it to you. And therefore, since animals are not a device like that to transfer to people, you should not be getting rid of your pets to shelters and things because you're afraid that your pet's going to be a COVID problem. It is not.
So that's good information. And again, you were talking about the AVMA. I've noticed they are texting you every day. They're sending emails. They've been really on top of this. And so that's been really good. And other people can go to that site to get information
There's
too.
a public access to that website. I'm on the veterinary side of it. It takes an ID. I'm a member of the American Veterinary Medical Association. I pay dues for that. It's a continuing education organization, really. So I get to their veterinary professional side, which is a little more in depth, probably wouldn't be of much interest to the general public, but there is a public forum on there that all this information is available.
So some clinics have been closing, and I think it was pretty interesting and tells me a little bit about you. Now, if a clinic closes, that's really their own.
You're hitting me here.
Yeah. Wait. So we don't. That's their decision, and that's fine.
It's perfectly fine for them to do that. No judgment whatsoever.
Every community is different,
Yep.
and people are facing
No problem
with kids, but you decided to stay open. And I already knew this about you, but you said to me, Julie, I took an oath.
I did. I've taken 2 oaths, really. I can only think of 2 oaths that I raised my hand and swore that I would do this. One was when I married you 40 years ago. Huh. I meant that. And when I graduated from vet school, I took an oath that I would take care of pets, but it's really all animals, livestock. And there's also a public health component to the oath that all veterinarians take. And guys, I mean, I don't have to tell you, this is a public health crisis that's going on. It doesn't involve animals. Therefore, I need to stay open to take care of the animals, the pets that are in my care for regular disease processes that are going on that have nothing to do with coronavirus. If I shut down, I mean, I want to be available to the animals and the clients that I took an oath to take care of them. And I'm telling you, I don't know how to say it any differently, but if I get COVID, being open, taking care of these pets, and if I have to be hospitalized because of it, and if I have to go on a ventilator because of it, and if I have to die for it, I don't care. I'm in.
Yeah. Well, and I already knew that about you. You love animals, and you're there to take care of them. And
with that said, that's me. That's Gary Beall. That's me. Speaking from my heart. I do not hold any of my staff members to that standard. They all know that we're open, but they do not have to come to work.
Right. Yeah, you've said that every day.
I say that almost every day, and they all, quite honestly, the culture of love that we have at Springfield Veterinary Hospital, they're all part of it. And they didn't take the oath as a veterinarian that I took, but they're all as concerned as I am. And if anybody's not, they know that just because Dr. Beall feels that way doesn't mean that I have to feel that way.
Right.
But they kind of all do.
Yeah. You've told everybody every day that if they're fearful in any way, they don't have to come in.
No, they do not. It's just a personal decision. reason that I don't judge anybody for.
Yeah, so you are open, and just because we have COVID doesn't mean that dogs still don't get hurt and need stitches or broken bones or hit by car. And then the one thing that you touched on, and the people who don't know me, my undergrad degrees and have a Bachelor of Science in Nursing from the Ohio State University.
Go Bucks!
And so I am always worried about, I don't think people quite understand that good health on a pet makes better health for humans.
Oh, my blood pressure is regulated because of my own dog.
That's so true. I mean, these dogs and pets are doing such a great job comforting people right now. I think we're going to have great stories when this is over about how pets help people get through this. But I'm talking about disease processes with people. And, you can get bit by a dog if it has rabies. And,
you need to get those rabies shots.
And if they don't have tick prevention, ticks can live and crawl on us too and bite them. And there's Lyme's disease.
Lyme's disease, other diseases from ticks.
And there's worms, that parasites people can get from pets. So
there are definitely some diseases that people can get from pets.
Right. And
coronavirus is not one of them.
So my point is, veterinarians have a public health responsibility to humans too, and you took that with your oath. So you are so open. You are an essential business, which is really a blessing during this COVID-19. Having said that, you did say a little bit about this, but at the clinic, you've offered some options for people who don't want to come in. You want to talk about that?
Oh, yeah. We have two. One is a little bit new. It's called curbside service. Some people they're really fearful, and I get that. And so we come out to the car, get your pet, and bring it in and examine it, and then call you on the phone, bring your pet back out to you. And that's new, and it's been exciting, really. We're practicing great medicine that way, and the clients are relieved of some of their fears of having to come into the clinic and be around other people, although there's not that many people in Springboro Veterinary Hospital at any one time. But if you're at all fearful, you don't care, you don't want somebody coming out to your car even and having interaction with somebody, taking your pet from you from the car into the clinic. We're having a lot of people, I mean a lot, take us up on our telemedicine option. We call it digital office calls. It can be called telehealth, telemedicine. It's referred to as a lot of things, but it's just done from your home. And I actually did one the other day when I was on a hike in the woods with my dog, and I initiated the call from there, and it can be done anywhere. I can be anywhere and you can be anywhere. It's really not a phone call. I don't really do it as a phone call unless we need to actually talk. We do it with a lot of technology, text messaging, FaceTime, videos, pictures, email. It's all done that way. And the good news is you don't have to leave your home. The bad news is I can't put my hands on the pet, and that's what I'm trained to do. But in these times, you may not want to come in and have me put my hands on your pet. So the digital office call or the telemedicine option is being utilized a lot. And I have found it to be better than I thought it would be as far as ability to help people or alleviate their fears of coming in and still be able to practice medicine on a different level.
Right. And when you say digital, it can be, we can work around whatever platform they have at home to make it easy.
Oh, you have iPhones, Androids, I think.
And text message and video. And take a video and Facebook. We've done whatever you need to do. Just call the office and they'll set up the appointment.
Our telemedicine option is pretty much customized to your technological skills and whatever you have technologically. We will work with that.
Nothing ever replaces hands-on exam which is a little different than human medicine, I would have to say, because a human can talk to you and tell you.
They can tell you more, yeah.
But I watch veterinarians. I watch what you guys have done over the years when you're touching this bone or that foot or this abdomen, and you watch the response of the dog. So nothing replaces that. But for right now, telemedicine's great.
You know that you and I both have a lot of friends that are medical doctors in the human medical side, and they tell me a lot of times that they wish their patients couldn't talk because you get misled with hypochondriacs and things. When I find a problem with a dog, it's real.
Yeah.
It's real.
You do. And so you're trained in that. So telemedicine does not replace a hands-on exam. However, right now it's a blessing.
And honestly, a lot of times we'll do the telemedicine call and we'll spend a lot of time and effort communicating with you, and we'll all agree.
Right.
You need to come in because I got to put my hands on that dog or cat.
So right now, if people do come in, there's only one pet and one person per pet.
If they do decide to come into the clinic, one person with a pet.
You have telemedicine available, and you have curbside, and you also have drop off, and you can come back and pick them up later.
You can do that too.
So those are all options for anybody who's worried about that. But I do want to ask you about something else, a couple things.
First of all, look on your face, this is going to be something off.
Well, no, I do have one a little bit. Well, let's start with the one that's a little off.
I can tell.
So what is up with people hoarding chickens?
Oh, yeah. I get that too, by the way, because I don't know if personally, Julie and I, we're farmers, really. We live on a farm.
Farmer wannabe.
Yeah, kind of small farmers. We've had chickens in the past. We raised chickens, and we didn't use them for meat. We used them for eggs. And I just thought it was cool. And I think we had like 30 birds at one time. Mm-hmm. And I learned a lot about chickens, that it's not as easy as you think. It's hard to control Mother Nature. I had raccoons kill my chickens. I had coyotes kill my chickens. I had a chicken hawk.
And dogs,
neighboring dogs. It's just not, I'm going to get a chicken, put it out in the yard, and it's going to lay eggs, and everything's going to be happy ever after. Because what's happened, what you say, what's up with it is this time of year, Easter is just this week, and all the feed stores are selling chickens because it's just what they do this time of year. A lot of times it's for kids that just want Easter little pets, and that's a big mistake. But, the feed stores are selling them to farmers too, because they're trying to repopulate their flocks. If you know what you're doing, that's a wonderful thing. And if times are going to get tough here, which I don't think they are, I think we're going to come out of this, just like the president says, soon and strong. But if you're thinking, maybe we need to be preparing for the worst, I want to start raising chickens, just going to the store and buying 15 or 20 chickens, you've got to have little lights to raise them with. You got to have feeders, you got to have water stations, and the chicken coop itself is paramount to protecting them from the things that even I, a veterinarian, had trouble fighting. It's just not something to take lightly, and there's cost involved, not just the price of the chicken.
It's very expensive.
It's expensive. Those eggs were the most expensive eggs I ever had.
They were good.
But they were also the best eggs I ever had.
Yeah, they were good. So people are hoarding chickens right now. I guess they're sold out everywhere. So I understand why you would want them, but the nurse in me says also, don't chicks carry salmonella and E. coli?
Yeah, they do. I hesitate to say what I'm going to say because I know somebody's going to combat it, but the point is valid. All the chickens that are raised in this country at all the big factories, Purdue Chicken and all that kind of stuff, they've all got salmonella, every single one of them. And so when you're buying chickens from the store, or you're buying even chicken from the grocery store, salmonella is there. They were raised with it. It's what we call ubiquitous. It's everywhere. But it's killed very rapidly at a low temperature. So in all of our chicken, we don't eat raw chicken. In China they do, but not here. Uh-huh. I had to say that. When you cook your chicken, the salmonella is gone. When you're raising chickens, you're handling those chickens, you're going to be having salmonella on your hands, on your clothes, and here again, hand washing and sanitation of yourself and the chicken coop and everything becomes really important. It's another thing that you're going to be exposed to. It's not coronavirus, it's salmonella. That's a bacteria.
Right.
And that's also very bad for you.
E. coli is another one.
E. coli is another bacteria that, well, it could kill you.
All right. So really a chocolate bunny would be much better.
Exactly right. Exactly right.
So I just found it fascinating that they're selling out on chickens. So I think it's something as a veterinarian, I think, caution people that they're going to do it right.
I don't want to say don't do it because I'm all about it. I think it's great to learn how to do it and do it right. Just know what you're getting into. One
of the other silver linings I think that's happened with COVID-19 is that the dog shelters, like I think first I heard about it in New York, are empty.
Yeah.
Isn't that cool?
It is cool, but I'm afraid.
Yeah, me too.
Because people are adopting pets now because they're home from work. What are they going to do with them when they go back to work?
Yeah.
Are they going to turn them loose? I doubt if they'll take them back to the shelter.
I'm hopeful that it's just this time they finally have time to spend some time on a pet.
If you did that, thank you for adopting a pet that might have had a bad demise had you not done that. But I also want you to take your commitment seriously and understand that, let's just say it's a 1-year-old dog, it's going to be a 15-year commitment. And please be committed to that and take care of it for its whole life, not just while you're home.
And for those who, some people are just getting them from the shelter to foster them while this is going on, and some of them will be going back. So thank you for that.
Foster's a different situation than adoption.
Yeah, and hopefully you'll consider keeping it if it works for you and your lifestyle. But we do have a podcast, I believe, if it's going to be right after this, because one of the other things that we are seeing, the shelters are empty. However, we're also seeing a ton of puppies at the office.
Oh, there's a whole podcast coming up on that, and it's a pretty good one.
Yeah.
I think it's going to be mostly about behavior. I don't want to give it away too much because Dr. Chip is going to be leading that podcast because he has a huge interest in that.
Huge heart.
So huge heart for that. So pay attention to the next podcast. Look forward to that one.
But so I have found it fascinating that people are hoarding chickens. The shelters are empty, and you guys are seeing a lot of puppies because people are getting puppies now because they have time to do it.
Just take care of them and keep them.
Yeah. Again, so this was our COVID-19 sort of public service.
Yeah. This one, we're not going to do a case of the week. We're not going to do a cool pet tip or anything product. This is just what's on our mind right now.
Right. So no, COVID-19.
People cannot get it from pets.
Right.
Pets can have it on their surface if you put it there.
Right.
But they're not going to get sick with it.
Correct.
Yeah.
Okay. All right. Anything else?
You know what? Just stay safe out there, everybody, because, we talked about how much we love these pets, but we love you too, and we want everybody to be safe, but we want everybody to be optimistic too, that America is a strong country. It's a God-fearing country, and if we all just kind of end this together and stick together, I can only say from the bottom of my heart, we're going to come out of this soon and strong.
I agree. All right. Thanks a lot.
Yep. Thank you, guys.